Good day everyone, I am Jolina Devilla and you will see me how to do the essential intrapartum and newborn care procedure. So the objectives for this are: first, to reduce maternal and newborn mortality rate; second, to provide appropriate and timely emergency newborn care to newborns in need of resuscitation; and lastly, to accurately assess infants' adjustment to the outside world. And for the materials or equipment, we have here gloves, dry linen, bonnet, oxytocin injection, plastic clamp, instrumental clamp, scissors, 2 kidney basins, eye ointment, stethoscope, vitamin K, hepatitis B and BCG vaccines, cotton balls, micropore tape, medicine cup, antiseptic solution, 2 sterile gloves, and leak-proof container or plastic bag, and lastly, 0.5% chlorine solution. Now, let's proceed to the procedure steps. And for the assessment, we have to assess the client's knowledge on essential intrapartal and newborn care. Second, we have to assess mother's progress of labor. Third, assess infant's airway, breathing, and circulation. Fourth, we have to check baby's breathing and color. And fifth, we have to check mother's vital signs and uterine contractions. And lastly, assess infant feeding cues. And for the planning, we have here at the end of this procedure, the infant was able to adjust to the outside world and mother was free from any intrapartal complications. And after that, we have to proceed now to the implementation procedure. And prior to woman's transfer to the delivery room, we have to ensure that the mother is in her position of choice while in labor. And second, we have to ask the mother if she wishes to eat or drink or void. And lastly, we have to communicate with the mother or inform her of progress of labor and give reassurance and encouragement. So watch these procedures as I do it to my patient. But before that, we have to perform hand hygiene. Good day, ma'am. I am Jolina Devilla, your student nurse for today. So I am here because I am the one assisting you for delivery room. But before that, I will get your vital signs first and state some information and of course ask you personal questions. Okay, ma'am? So I will get first your body temperature and your BP. ma'am, earlier we're done getting your vital signs and everything is normal. Now, ma'am, I will just ask you some questions about your previous experiences on delivering a baby, progress of labor, and newborn care. Okay, ma'am, so have you ever experienced delivering a baby? Yes, because I delivered the baby a year ago. Okay, ma'am, that's good. And ma'am, I will just ask you if you are in a comfortable position and what position do you prefer when you are in delivery room? Semi-upright. Okay, ma'am, semi-upright position. Noted, ma'am. So, ma'am, do you have any request or food you like or drinks? No. Ma'am, do you want to go to comfort room before we prep you for delivery room? No, it's okay. Okay, ma'am. I will just give you some knowledge and, of course, encouragement that you can do it later. Okay, ma'am? Just do the pump blow, wherein you will just breathe 2 times. Then on your third, you have to hold your breath, and then after that, you have to push like this, ma'am. Okay? Then hold and then push. Okay, ma'am? So you can do it. So now we are in the delivery room and our patient is in preparation for delivery. But before that, we have to check the room temperature, which is 26 degrees Celsius, and it is normal because the range amount is 25 to 28 degrees Celsius. And now we have to ask our patient if she is in a comfortable position. So, ma'am, are you in a comfortable position? Yes. Okay, ma'am. So your position, like what you said earlier, is semi-upright position. And after we ask our patient, we have to provide privacy. So we have to close the windows or curtains and the doors. Now we have to remove all the jewelries and perform hand hygiene. So as you can see, I am wearing clean gloves because in preparation for assembling all the materials and of course cleaning the perineal area of my patient. So as you can see, I prepare a clear, clean newborn resuscitation area that is easy to reach and all the materials needed for the delivery. So after we put on our clean gloves, we have to perform and clean the perineum of our patient. So we will put underpad and bedpan. Okay, let's start. Okay, ma'am. So wait for a while. I will just put underpad because I will clean your perineum. Okay, just hold on a second. I will put the bedpan. Okay, now just wait. I will clean your perineal area. Okay. So in cleaning the perineal area and perineum, you have to follow the rule of 7 and use cotton balls with antiseptic solution. After cleansing the perineal area, dry it up with clean cotton balls. And after drying up the perineal area, you have to do aftercare by removing the underpad and bedpan. And after you do the aftercare, you have to perform hand hygiene and wear now your sterile gloves. So this is how you put a sterile gloves. So you have to use your non-dominant hand and pick up the glove for your other hand by the cuff. And let the glove hang with the fingers pointing downward. And if the glove does not go on straight, wait to adjust it until you put on the other glove. So sterile gloves help prevent surgical site infections and reduce the risk of exposure to blood and body fluid pathogens for the healthcare workers. Okay, mommy, so I will put this dry linen on your abdomen and later on I will ask you to do the pant blow breathing, okay? You can do it, mommy, okay? Okay. Are you ready? Yes. Okay. 1, 2, 3. Okay, push. 1, 2, 3, hold and push. Okay. It's a baby girl. Time of birth 12:30 p.m. So after you inform the mother of the outcome, you have to thoroughly dry the baby for at least 30 seconds starting from the face, head, going down to the trunk and extremities while performing a quick check for breathing. And after that, you have to remove the wet cloth and place the baby in skin-to-skin contact on the mother's abdomen or chest. Now, cover the baby with the dry cloth and the baby's head with a bonnet. Now, exclude a second baby by palpating the abdomen of the mother in preparation for giving oxytocin. And after that, you have to use the wet cloth to wipe the soiled gloves. Then dispose the wet cloth and give IM oxytocin within 1 minute of baby's birth to the mother. Now, remove the first set of gloves and decontaminate them properly for at least 10 minutes. Now, perform hand hygiene again as you wear your new pair of sterile gloves. And now you have to palpate the umbilical cord to check for pulsations. And after pulsation stops, clamp cord using the plastic clamp or cord tied 2 centimeters from the base and place the instrument clamp 5 centimeters from the base. Then cut near the plastic clamp and knot midway. Then now, we will proceed to the stage of placental delivery. We will wait for strong uterine contractions, then applied controlled cord traction and counter traction on the uterus, continuing until placenta was delivered. And after that, we have to massage the uterus until it is firm and inspect the lower vagina and perineum for lacerations. Now, examine the placenta for completeness and abnormalities. Then, we have to do aftercare for our mother as we do perineal care. And after we dried it up, we have to apply perineal pad or napkin or cloth. So now we go to check the baby's color and breathing. And of course, we also have to ask the mother if she is in a comfortable position or her uterus is contracting. Now we have to dispose the placenta in a leak-proof container or plastic bag. Now we have to decontaminate the second pair of gloves and also the instruments for about 10 minutes. Then perform hand hygiene again. And as I perform hand hygiene, I'm gonna wear now my new pair of sterile gloves as I administer medicines to the baby. And I'm gonna advise the mother to maintain skin-to-skin contact. Mommy, just take your time and have bonding with your baby. And in between 15 to 90 minutes, Mommy, so I want you to observe any feeding cues that your baby will do onto you. So for example, she is rooting something on your abdomen or breast. So in terms of your positioning or feeding, I will position you in semi-upright so that you can fully breastfeed your baby. Okay, Mommy? Okay, Mommy, now that you completed breastfeeding, I will administer eye ointment on your baby to prevent eye infection and also vitamin K for blood clotting and to prevent any brain damage and hepatitis B to prevent liver disease and BCG injections to fight against tuberculosis. Okay, so mommy, we're done giving vaccines to your baby. And now it is advised that we will not bathe the baby for about 6 hours to prevent your baby from getting cold or increased her body temperature. So if your baby is showing feeding cues, you have to feed your baby, okay? Okay. So in the first hour, we have to check baby's breathing and color and check mother's vital signs and massage uterus every 15 minutes. So in the second hour, we have to check mother-baby diet every 30 minutes to 1 hour. So I will do this like this. So, how are you and your baby, ma'am? Oh, we're fine. So now I will be discussing to all of you the complete records and evaluation of the mother and the child. So before we proceed to the delivery room earlier, we check her vital signs and everything is normal, which is 120 over 80, and her body temperature is 37. And now that she undergone delivery, her vital signs is slightly high, which is 130 over 90, and her body temperature is 37. And as we check her baby's breathing or respiratory rate is 60 beats per minute and the color is pinkish red. And everything that we've done earlier, like breastfeeding and checking of skin-to-skin contact and relationship with the mother and the child, everything is normal and everything flows to the right procedure, and the mother was able to cooperate and listen to us physicians. And for the evaluation, the infant was able to adjust to the outside world and the mother was free from any intrapartum complications. And to add up, there are no abnormalities with the placenta and the placenta is complete and it is characterized as Calt's placenta since it is shiny. And after we do the aftercare, we have to perform hand hygiene. Thank you for watching.